The following video was produced by Theragenics Corporation, makers of the TheraSeed device with palladium-103 used in brachytherapy treatments of prostate cancer. The claims made are based entirely on scientific data published by physician researchers. 5 of these cancer specialists appear in this video to lend support to the findings that TheraSeed treatment produces results better than or equal to other treatments.
The result came back that I had a 5.8 PSA.
And told me that I had just celebrated my last Christmas, that I had prostate cancer and an advanced case.
And I felt myself and my whole body was just numb. It was probably tougher for my wife.
You have cancer, we need to operate, and I can give you a penile implant if you need one.
Basically, it just scared the hell out of me.
When I realized that I wasn't going to kill over dead, I had to choose some course of action to take.
Immediately went into a project mode. It's time to learn.
He did tons, and I went with him, but tons of research.
You don't let things control your life, you take control of yourself.
I said, I want a second opinion. You know, I want another opinion from another radiologist.
We shouldn't take our life and say, here, you handle my life for me. And I hope you do well with it.
It depends on what doctor you're seeing. If you see an internist, he's thinking about you. If you see a surgeon, he wants to operate. That's his job.
But the informed man will, in almost every case, walk away from surgery and walk towards seeding.
I chose that miracle seed called TheraSeed, and I'm so very grateful that I did.
The attacks of 9/11 introduced America to a leader of decisive, intelligent action. Those same qualities also served Rudolph Giuliani when he was diagnosed with aggressive prostate cancer. After studied deliberation, the New York mayor chose a less invasive, outpatient procedure called brachytherapy, or radioactive seeding. Furthermore, he insisted on receiving TheraSeed treatment with palladium-103. After a successful procedure, Mr. Giuliani told a national television audience why he had chosen brachytherapy with TheraSeed. I thought this worked better, and I thought I could just handle it better. It was just a better chance of killing the cancer.
It's obviously less invasive than surgery. It was less interruptive on my life.
Coincidentally, Mayor Giuliani wasn't the only man at Ground Zero who'd recently received TheraSeed treatment. OSHA disaster specialist Richard Jeffrey was implanted by Dr. Gregory Merrick 9 months before 9/11.
The treatment and the process didn't bother me at all. I mean, I regained my normal life within a month.
This Straight Talk video will outline the treatment chosen by Rudolph Giuliani, Richard Jeffrey, and over 100,000 other men. You'll meet more of them and discover why, when diagnosed with prostate cancer, they too chose brachytherapy with TheraSeed.
It's the least invasive procedure, it's high-tech, and it works.
And most important, you'll hear from the physicians who authored much of the data comparing brachytherapy with TheraSeed to other treatments, including surgery.
I think that the advantages of brachytherapy are outweighing the advantages of surgery, and I think more and more people are headed this way.
You know, the data speaks for itself.
This communication is based on data. But what is the basis for the data? Who published this data? And what do the data reveal? Experts will answer each question. But first, just how widespread is prostate cancer?
The lifetime risk of developing prostate cancer is about 1 out of 6. This year, approximately 30,000 men will die, but about 1 out of 32 men in America will ultimately die of prostate cancer.
Not only are a growing number of men being diagnosed with prostate cancer, nearly 250,000 this year, but patients are being identified at younger ages.
It's no longer a disease of the elderly, it's a disease of everyone.
I just couldn't believe that, that it was happening. I thought it was just for older men.
We caught my son, Roe, who was 37 years old at the time.
It's a fact. Adult males of all ages are now diagnosed with prostate cancer.
I think men should have a PSA starting at age 50. If there's a family history, they should start having a PSA at age 40.
PSA is a simple blood test.
Thousands owe their lives to the PSA test, and physicians owe their research to it. Because until this diagnostic tool was developed, there was no way to scientifically determine the success or failure rate of any prostate cancer treatment.
Basically, PSA became clinically available in 1988, so all of these treatments really have maximum follow-ups of about 17 years.
And what the follow-up data prove is that brachytherapy with TheraSeed is better than or equal to surgery and works with a lower risk of complications.
I think the data with brachytherapy is so compelling, both from a complication standpoint and a cure standpoint, that I think everyone will be treated this way soon.
It's just a better way.
How are you?
Ron, how are you?
Dr. John Blasco is considered a brachytherapy pioneer. He has overseen the treatment of more than 9,000 patients, all with seed implants. His documented success helped make brachytherapy a mainstream treatment. Brachytherapy is simply the precise placement of radioactive seeds that kill cancer cells while minimizing exposure to nearby tissue and organs.
There's no cutting or operation involved. It simply is the process of inserting needles through the skin between the legs into the prostate, where the needles are then seen on the ultrasound screen. The physician can then guide the needle into the proper place that's been planned into the prostate and then drop off a row of these radioactive seeds as the needle is withdrawn. So it's evolved from a procedure that at one time required hospitalization, open operation, to one that is now a 30-minute outpatient procedure for patients.
Some of the nation's leading physicians performing brachytherapy trained under Dr. Blasco.
Now, Megan, I again want to double-check his apex.
For more than a decade, Dr. Kent Wallner has implanted about 500 patients a year. Most return home within hours of their treatment.
I thought it would be a lot tougher, but actually it's very simple.
Not only can patients walk away after brachytherapy with TheraSeed, but they can usually leave their entire experience with prostate cancer behind.
I have no question in my mind that brachytherapy is the absolute best way to cure prostate cancer. The highest cure rates, the lowest complication rates.
Nobody had realized urethral tolerance and toxicities.
Prostate cancer treatment and urinary complications were once virtually synonymous, says Dr. Gregory Marek, the author of a major medical school textbook and numerous published studies, and member of a national physician panel that evaluates prostate cancer treatments. Dr. Marek says brachytherapy with TheraSeed almost never results in either severe or long-lasting urinary consequences.
What we do know is the chances of being incontinent are less likely after brachy than the other procedures.
Dr. Michael Dottoli is also a prolific research author and has performed more than 10,000 brachytherapy procedures. A former surgeon, he says brachytherapy not only results in less incontinence than surgery, but also a lower rate of impotence.
As you look at this data, it's just profound how successful the procedure is in contrast to the surgery.
And finally, meet Dr. Gerald Sharkey. He uses the TheraSeed device exclusively during brachytherapy procedures. His research may show the most important result of all. Brachytherapy with palladium-103 produces results better than or equal to surgery and has superior efficacy for high and intermediate risk patients.
It's a one-time procedure that you do in the office as an outpatient. They're back to their normal activity within a day or two, at most. And the cure rates are equal to or better than with radical prostatectomy.
We had seen a video, and on our treks of surgeons, and it was awful for him.
Most of the prostate cancer patients interviewed for Straight Talk were initially advised to undergo a radical prostatectomy. Those who researched the procedure were invariably taken aback by what they learned.
Had I had surgery, it would have affected my life far more.
Probably 6 months out before you're going to, go back to some type of normal life. Even longer.
They don't call it radical for nothing.
More than half a century after it was introduced, radical prostatectomy remains major surgery during an era when many other cancer treatments are moving to less invasive approaches.
all types of cancer treatments are becoming less invasive as we now start to focus not only on cure, but on quality of life outcomes.
Surgery is an invasive procedure impacting two significant quality of life outcomes, incontinence and impotence. The effect is often permanent.
What they're really getting into is the beginning of a long saga.
Surgical complications result from the location of the prostate. The urethra or urinary canal goes right through the middle of the prostate before connecting with the bladder. To remove the prostate, the urethra must be severed. Suturing reconnects it, but urine leakage can result and can worsen over a surgery patient's lifetime.
Stress incontinence becomes more and more incontinence, namely the leaky faucet where it just doesn't stop and it becomes a drip, 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 and that's a life ruiner.
I didn't want to wear a diaper to play tennis, and it's very selfish, but lifestyle is lifestyle.
There's a very wide range of incontinence rates that exist for radical prostatectomy, but even the best results are inferior to what we see with brachytherapy.
The prostate is also adjacent to nerve endings controlling penile erections. Even when surgeons employ so-called nerve-sparing techniques, sexual performance problems may occur.
When we look at the radical prostatectomy literature from Harvard, from Dr. James Talcott's survey, when he looked at men who underwent bilateral nerve-sparing procedures, and those patients filled out a validated quality of life instrument, only 7% maintained erection sufficient for vaginal penetration.
I'm a 66-year-old man, but I have a 50-year-old wife, and we're sexually active, right?
For Lawrence Harton, the higher likelihood of impotence from surgery steered him to brachytherapy with TheraSeed. He's never missed a beat.
Man, I feel great. I mean, I'm 8 weeks into the treatment, and I have hardly any symptoms at all.
So why do men bounce back from brachytherapy with TheraSeed with fewer and less severe side effects than surgery? Because seeding kills the cancer while leaving the prostate intact.
We are doing the same thing. Instead of removing it with a knife, we're removing it with a seed.
Two recently developed surgical techniques, laparoscopy and robotic radical prostatectomy, were developed in hopes of improving post-surgical outcomes. Both are new, so long-term effectiveness is not yet known.
From ABC News.
During an ABC News report, one well-known cancer expert disputed claims that the robotic procedure is an improvement over traditional surgery. Dr. Peter Albertson said patients do not experience significantly shorter hospitalizations or higher continence rates, and doctors don't think it has better outcomes related to sexual function. He concluded by remarking, "So then the question becomes, what is the advance?" There is, however, in addition to brachytherapy, another minimally invasive option to surgery known as cryotherapy.
I think that we need to approach this potential modality with extreme caution.
Cryotherapy attempts to kill cancer by freezing the prostate. However, the urethra, which runs through the organ, must be warmed during the procedure to prevent severe urinary complications. Some question whether this technique kills all cancer cells adjacent to the urethra. No long-term data exist about cryotherapy, and Dr. Merrick says these men may not be cured.
We'll see a lot of late failures. We may see some initial PSA responses, but I think at year 4, 5, 6, 7, we're going to start to see a plethora of recurrences. We also know that virtually everybody with cryo is impotent.
External beam radiation techniques can also lead to complications because they expose healthy tissue and nearby organs to radiation.
When you increase the dose of radiation, you irradiate the rectum and the bladder, having a lot of complications.
Data also show that TheraSeed treatment is so effective, supplemental radiation beam treatment is usually unnecessary.
Have been able to demonstrate that in a sizable portion of men, external beam radiation therapy as a supplement to brachytherapy can be dramatically reduced and potentially eliminated.
When palladium-103 came onto the marketplace, to me that was a godsend because I felt that iodine, while it was better than surgery, was not nearly as good as palladium.
Palladium-103 and iodine-125 are radioactive isotopes that treat cancer in different ways. TheraSeed with Palladium-103 provides approximately 3 times the initial dose, delivered 2 to 3 times faster than iodine-125-based seeds. It then ceases most of its activity. Iodine-125 delivers a less powerful dose and remains active far longer. These results are exactly what logic alone would indicate. The shorter lifespan of palladium reduces the duration of side effects and results in significantly fewer complications compared to iodine seeds. This is especially true regarding urinary irritation and urgency.
What we found on the urinary side is that patients who were implanted with TheraSeed had a faster recovery to normal urinary function than patients implanted with I-125.
We do see that the side effects are resolving sooner in the palladium patients.
With iodine, the few patients that I've taken care of that I haven't treated have irritative symptoms for a year, even a year and a half or 2 years. And I think that's a big negative.
In terms of impotence, again, TheraSeed is the winner. Dr. Marek had his patients privately fill out a sexual performance survey. It revealed that TheraSeed recipients suffer far less impotency than do surgery patients, and those who do encounter erectile dysfunction issues generally respond very favorably to erectile stimulating drugs.
So when we look at the potent men plus the impotent men who use Viagra, overall 92% of our patients were able to maintain erections sufficient for vaginal penetration.
So the data prove that brachytherapy provides a lower risk of complications. But what do studies reveal about the procedure's success? Dr. Gerald Sharkey recently published a comprehensive study which reveals that low-risk patients enjoy a very high degree of success with both seeding and surgery. However, intermediate-risk patients are served dramatically better by brachytherapy, and high-risk patients stand more than double the chance of an excellent outcome when brachytherapy is used.
And if you're intellectually honest about this, the brachytherapy is equivalent or better than radical prostatectomy.
So given that data prove brachytherapy with TheraSeed has distinct advantages, why do men undergo other forms of treatment? In all honesty, they may not know better.
You must learn a little something about you, your own body. Women know more about our bodies than we men do.
This is your probability of success with surgery. This is your probability of success with brachytherapy. You know, the data speaks for itself.
But what happens when men aren't given the data? Well, many end up having surgery because surgery is generally the first and often the only option offered by urologists.
Many urologists still recommend surgery because that's what they were trained to do.
I think I've gotten to the point where I've recognized that no matter how good the brachytherapy data looks and no matter how bad the surgery data looks, the surgeons will still cut.
A leading urologist himself, Dr. Gerald Sharkey agrees that when patients visit a urologist who is not trained in brachytherapy, they'll often be pressured to have surgery.
The problem currently in the community is if you go to the usual urologic practice, they're going to be encouraged to have radical surgery.
The second reason patients end up in surgery is a strong reluctance, especially among older men, to insist on second opinions and visit physicians of different specialties.
It goes to that old adage about men just don't like to show their heinies, so they're not going to go to physicians, which is ridiculous. You'll die with that philosophy.
We visited 18 doctors throughout the U.S.
Businessman Dave Ederer actually assembled a board of advisors to help gather and assimilate treatment option data. The board's unanimous decision, brachytherapy with TheraSeed.
Seeds are having better cure results, along with significantly better side effects.
On the other hand, Ron Anderson initially saw only urologists, and each of them advised him to schedule surgery. In the end, Mr. Anderson chose TheraSeed treatment because he was open to a non-surgical option and happened to be watching television instead of playing tennis.
I was scheduled for the following Tuesday, as I recall, to have the surgery done. And on the Thursday before, I saw an ad on TV about a seed implant.
Or ask your doctor about TheraSeed, a prostate cancer treatment with a faster recovery.
The maker of TheraSeed has long engaged in education campaigns to alert men about prostate cancer treatment options and early cancer detection.
Ringing the opening bell, Christine Jacobs, Chairman and CEO of Theragenics, as well as New York City Mayor Rudy Giuliani.
Theragenics has been a tremendously active member of the prostate healthcare community, reaching out to men nationwide. And the maker of TheraSeed assists cancer patients needing timely treatment information in a number of ways. The company has an informative website, offers a full array of educational brochures, and sponsors a telephone call center staffed by nurses and cancer educators. These specialists can provide callers with materials, physician referrals, and explanations about data.
I'm so happy for that patient information that Theragenics makes available. It's dynamite. You got human beings talking to you on the other side.
It also inspires confidence that these physicians, among the most published and experienced brachytherapists in the world, exclusively choose TheraSeed.
And that's what I'm going to use for my patient, because I'm always going to give my patient the best treatment imaginable.
The quality control at Theragenics that makes TheraSeed has been superior to anything that I've seen, and my results speak for themselves.
We trust that you are now better informed about brachytherapy and TheraSeed with Palladium 103. You've seen the facts, backed by scientific data, that demonstrate its results are better than or equal to surgery, and it works with a lower risk of complications than radical prostatectomy. And you've learned that you have the power to make the treatment decision that is right for you and your lifestyle.
After about 2 or 3 days, you can do anything you like.
I'm scheduled to play tennis on Tuesday.
All right. Well, you shouldn't have any problem with that. Water skiing on Saturday, that was only 2 days later, and played golf in a golf tournament on Sunday.
I had this procedure done on Thursday. On Tuesday, I'm hiking in the mountains of North Carolina with my kids.
I love to fish. I love to hunt. I'm in the woods every weekend I can. I'm on the water, hunting, fishing, and my life hasn't been altered by it. You know, I'm tickled to death. Really am.
It's just a lot better quality life.
For further information, Theragenics invites you to call the TheraSeed Prostate Cancer Information Center or visit www.theraseed.com.